side of the frontal lobe is the olfactory tract. It ends in the olfactory bulb, from which the fibers of the first cranial nerve, the olfactory nerve, emerge. Each cerebral hemisphere contains a cavity, the lateral ventricle, that's filled with cerebrospinal fluid. The lateral ventricle has an anterior horn, a body, a posterior horn, and an inferior horn. The anterior horn is in the frontal lobe, the body is in the parietal lobe, the posterior horn is in the occipital lobe, and the inferior horn curls downward and forward into the temporal lobe. To see where the lateral ventricle communicates with the third ventricle, we'll go round to a medial view. The communication is here, at the interventricular foramen. To see how the lateral ventricle, the third ventricle, and the fourth ventricle are connected, we'll look at a brain that's been divided in the midline. Here's a midline section through the third ventricle. Here's the third ventricle. This strand of vascular tissue in the roof of the ventricle is the choroid plexus, which produces cerebrospinal fluid. Here's the interventricular foramen opening into the lateral ventricle. The choroid plexus passes through the foramen and continues into the lateral ventricle. The cerebrospinal fluid that's formed in the lateral and third ventricles passes through this narrow passage, the cerebral aqueduct, and into the fourth ventricle. Fluid leaves the fourth ventricle through three openings: the lateral apertures, the right one is in the depths of this recess, and the medial aperture, which is in the midline, here. It's easier to visualize the medial opening in this dissection. Here it is, in the inferior medullary velum. The lateral openings are here. The medial opening comes out here, between the cerebellum and the medulla. The lateral opening on each side comes out just below the cerebellar peduncles. These openings lead to the subarachnoid space surrounding the brain and spinal cord. We'll see where the cerebrospinal fluid is absorbed later in this tape when we look at the blood vessels. We'll return now to the underside of the cerebrum to look at the structures that form the floor of the third ventricle, which is here. Here's the optic chiasm. Behind it, this tubular structure that's been divided is the infundibulum, the stalk of the pituitary gland. These two projections are the mammillary bodies. To see how the pituitary gland is attached to the brain, we'll look at an intact specimen divided in the midline. Here's the floor of the third ventricle. Here's the optic chiasm. Here's the infundibulum, leading down to the pituitary gland or hypophysis. The anterior and posterior parts of the pituitary gland are quite distinct. The pituitary gland sits in the pituitary fossa. The pituitary fossa bulges downwards into the roof of the sphenoid sinus. This area just above the pituitary stalk is the hypothalamus. In the dissections we've seen so far, including this one, the picture has been simplified by removing the important arteries that surround the base of the brain and run in the major sulci. We'll see these later in this tape. Now let's review what we've seen of the brain. Here's the cerebrum, the cerebellum, and the brainstem. Here are the medulla, the pons, and the midbrain. Here's the superior medullary velum, the floor of the fourth ventricle, and the inferior medullary velum. Here are the cerebellar peduncles, superior, middle, and inferior. Here are the pyramid and the olive. Here are the filaments of the hypoglossal, the cranial part of the accessory, the vagus, and the glossopharyngeal nerves, the vestibulocochlear and facial nerves, the abducent nerve, and the trochlear nerve. Here are the colliculi, inferior and superior, and the pineal body. Here's the medial geniculate body, the lateral geniculate body, and the optic tract. On the cerebellum, here's the primary fissure, the anterior and posterior lobes, the vermis, and the roof of the fourth ventricle. Here are the cerebral hemispheres. Here's the corpus callosum. Here are the frontal, parietal, occipital, and temporal lobes. Here are the oculomotor nerve, the optic chiasm, the optic nerves, the infundibulum, and the mammillary bodies. In the model, here are the lateral ventricles, the third ventricle, and the fourth ventricle. Here's the third ventricle, the interventricular foramen, the choroid plexus, the cerebral aqueduct, and the fourth ventricle. Here's the hypothalamus, here's the infundibulum, and the pituitary gland. That brings us to the end of this section on the brain. In the next section, we'll look at the cranial nerves. In this section, we'll look at the 12 cranial nerves, the sympathetic trunk, and the cervical nerves. The cranial nerves are numbered by the order in which they leave the cranial cavity. Earlier in this tape, we saw them emerging from the brain. In this section, we'll follow the course of each nerve, look at its principal branches, and summarize its functions. We'll begin with the first 6 cranial nerves. The first, the olfactory, and the second, the optic, transmit our senses of smell and of eyesight. The third, the oculomotor, the fourth, the trochlear, and the sixth, the abducent, are motor nerves to the eye muscles. And the fifth, the trigeminal, is a large motor and sensory nerve to the face and jaws. The first cranial nerve, the olfactory nerve, is extremely short. It consists of a series of fine filaments which arise from the olfactory bulb on the underside of the frontal lobe. On each side, the olfactory bulb lies here, just above the cribriform plate. Here's a frontal section in the dry skull that goes through the cribriform plates. They're here. On each side, the cribriform plate forms the narrow roof of the nasal cavity. Here's a medial view of the nasal cavity. The cribriform plate is here. The filaments of the olfactory nerve, here they are in close-up, pass through the cribriform plate and run just beneath the mucous membrane to reach nerve endings in this olfactory area on the lateral and medial surfaces of the nasal cavity. The next nerve we'll look at is the second cranial nerve, the optic nerve. We've seen the proximal ends of the optic nerves emerging from the optic chiasm. Here's the optic nerve passing forward beneath the dura to enter the optic canal, which starts here. Here's the optic canal in the dry skull. Here on each side of the optic chiasm are the divided internal carotid arteries. Just beneath the chiasm is the roof of the pituitary fossa. Here's the divided stalk of the pituitary gland. To follow the optic nerve, we'll remove the roof of the orbit, leaving the optic canal intact. We'll remove this nerve and the orbital fat, and these two muscles, which we'll see later. Here's the optic nerve. It enters the orbit between the tendons of origin of the rectus muscles. It passes forwards and laterally to enter the back of the eyeball. Strictly speaking, the optic nerve isn't a nerve, it's an extension of the brain. It's covered throughout its course by extensions of all three meningeal layers, dura, arachnoid, and pia. Here we've made a window in the dura surrounding the optic nerve. Here's the edge of the dura. Here's the nerve itself. Here's the arachnoid. The dura is continuous with the outer layer of the eyeball, the sclera. We'll be returning here shortly. For now, we'll put the contents of the orbit back in place. The optic chiasm is a crossover point for optic nerve fibers. The fibers of each nerve that connect to the medial half of the retina cross over into the opposite optic tract. The fibers that connect to the lateral halves of the retinae stay on the same side. Now we'll move on to look at the third, fourth, and sixth cranial nerves, the oculomotor, trochlear, and abducent. They're motor nerves. Between them, they supply the 6 muscles that move the eye and also the levator of the upper lid. As we've seen, the oculomotor nerve arises between the cerebral peduncles, the trochlear nerve arises from the back of the midbrain, and the abducent nerve arises below the pons. The bony opening that these 3 nerves pass through is the superior orbital fissure, but their openings in the dura are quite a bit further back. The oculomotor nerve passes through the dura just alongside the posterior clinoid process, which is here. The trochlear nerve passes through the dura here. The abducent nerve down here. To follow them, we'll remove the dura over this area. We'll also remove this structure that we'll see later, the trigeminal ganglion. This cavity that we've opened into is the cavernous sinus. In the living body, it's filled with venous blood. Within the cavernous sinus lies the internal carotid artery. The third, fourth, and sixth nerves pass forward in the lateral wall of the cavernous sinus. Here's the oculomotor, here's the trochlear, here's the abducent. All 3 nerves pass forward into the orbit through the superior orbital fissure, which is here. The 7 muscles in the orbit that these nerves supply are the 4 rectus muscles, the 2 oblique muscles, and the levator of the upper lid. The oculomotor nerve supplies 5 muscles. The trochlear and abducent nerves supply just 1 muscle each. To follow these nerves, we'll move forward to the orbit again. We'll divide and displace the 2 muscles in the roof of the orbit. These are the levator of the upper eyelid, levator palpebris superioris, and beneath it, the superior rectus muscle. Here's the optic nerve, as we've seen already. Here's the superior oblique muscle going round its pulley or trochlea. Here are the medial rectus and lateral rectus muscles. We'll go round to a front view to see the nerves better. The oculomotor nerve divides into an upper and lower branch. Here's the upper branch, supplying the levator palpebris superioris and superior rectus muscles. To see the lower branch, we'll remove the optic nerve. Here again are the medial and lateral rectus muscles. Down here is the inferior rectus. The only muscle not on view here is the inferior oblique, which is beneath the eyeball here. Here's the lower branch of the oculomotor nerve. It supplies the medial rectus and inferior rectus and the inferior oblique muscles. In addition, by these tiny, short ciliary branches, the oculomotor nerve gives parasympathetic motor supply to muscles within the eye which cause constriction of the pupil, the sphincter pupillae and ciliary muscles. Here's the trochlear nerve, the fourth cranial nerve. It supplies just the superior oblique muscle. Here's the abducent nerve, the sixth, supplying its one muscle, the lateral rectus, which abducts the eye. We'll be returning to the orbit once again in just a minute to look at branches of the fifth nerve, the trigeminal. For now, we'll replace the contents of the orbit, including this nerve, the frontal nerve, which is part of what we'll come to next. Now we'll move on to look at the fifth cranial nerve, the trigeminal. It's the largest of the cranial nerves and by far the most complex. It's named from the fact that it has three major branches, the ophthalmic, the maxillary, and the mandibular. The main functions of the trigeminal nerve are to provide sensation to the face, the nasal cavity, and the oral cavity, and to provide motor supply to the muscles of mastication. As we saw in the last section, the trigeminal nerve emerges from the pons and passes forwards. To follow it, we'll go to an earlier stage of the dissection that we've been looking at. The trigeminal nerve passes forwards from the pons into a tunnel in the dura. The tunnel leads into a side cavity, the trigeminal cave, which we'll expose by removing the overlying dura. Here's the trunk of the nerve. Here are its three branches, the ophthalmic, the maxillary, and the mandibular. All the sensory fibers of the trigeminal nerve synapse in this massive ganglion, the trigeminal ganglion. In relation to the dry bone, the trigeminal ganglion is here. The openings for the three branches are the superior orbital fissure for the ophthalmic, the foramen rotundum for the maxillary, and the foramen ovale for the mandibular. The first branch of the trigeminal, the ophthalmic nerve, passes forwards through the superior orbital fissure. As it passes through the fissure, it divides. It gives off the frontal nerve, which runs just beneath the roof of the orbit, and divides into cutaneous branches which go to the forehead. In addition, the ophthalmic nerve gives rise to the lacrimal nerve, which supplies the lacrimal gland, and the nasociliary nerve, which gives off one or more ethmoidal nerves and a cutaneous branch, the infratrochlear nerve. Through two long ciliary nerves, here's one of them, the nasociliary nerve provides sensation to the eyeball. The branches of the frontal nerve that we saw emerge onto the face around the orbital margin or through openings in it. The branches of the frontal nerve are the supraorbital, the supratrochlear, and the infratrochlear. These supply the forehead, the upper eyelid, and the upper part of the nose. The ethmoid branches of the nasociliary nerve supply this part of the lining of the nasal cavity. Now we'll move on to look at the second and third divisions of the trigeminal, the maxillary and mandibular nerves. Before we look at these two nerves, which are both quite complex, we'll spend a minute reviewing the region into which they emerge. It's a little complex too. To see it, we'll first look at a dry skull in which the zygomatic arch has been removed. Here's the area we'll be looking at. Here's the underside of the greater wing of the sphenoid bone. Here's the lateral pterygoid plate. Here's the back of the maxilla. This gap between the pterygoid process and the maxilla is the pterygomaxillary fissure. It's continuous with this gap between the maxilla and the greater wing of the sphenoid, the inferior orbital fissure. Here's the inferior orbital fissure seen from in front. The maxillary nerve emerges here, deep in the pterygomaxillary fissure. The mandibular nerve emerges here, behind the lateral pterygoid plate. To get to this remote area in a dissected specimen, we have to remove several major structures. First, the masseter muscle, then the deep temporal fascia, then the zygomatic arch, and then the temporalis muscle, and the ramus and coronoid process of the mandible, and finally this muscle, the lateral pterygoid, together with the condyle of the mandible. This brings us into the infratemporal fossa. Before we look at the nerves, let's get oriented. Here's the underside of the greater wing of the sphenoid. Here's the lateral pterygoid plate, the back of the maxilla, the pterygomaxillary fissure, and the superior orbital fissure. This is the medial pterygoid muscle. It slopes downwards and outwards towards its insertion on the medial aspect of the mandible. This muscle is the buccinator. Now that we're oriented, let's look at the maxillary nerve. As we've seen, the maxillary nerve runs forwards from the trigeminal ganglion and enters the foramen rotundum, which is here. Here's the foramen rotundum in the dry bone. We'll go round to the outside to see where it emerges. Here it is, well hidden in the pterygomaxillary fissure. The foramen rotundum goes out of sight as we go round to a lateral view of the pterygomaxillary fissure. Now, we'll return to the dissection. Here's the maxillary nerve running forwards across the pterygomaxillary fissure. As it approaches the maxilla, it divides into branches. The continuing trunk of the nerve is known as the infraorbital nerve. We'll follow it first. The infraorbital nerve runs forward into a bony tunnel in the floor of the orbit. It emerges again here at the infraorbital foramen. The infraorbital nerve divides into palpebral, nasal, and labial branches. These supply the lower eyelid, part of the nose and cheek, and the upper lip. The branches of the maxillary nerve supply the upper teeth, the nasal cavity and palate, and the upper part of the cheek. Most of them run through tunnels in the bone. Because of this, and because they're small, they're hard to show in a dissection. To indicate where they run, we'll add lines to the picture. The upper teeth are supplied by the superior alveolar nerves, posterior and anterior, which together form a loop. The posterior superior alveolar nerves, in this case there are two, branch off behind the maxilla and run down to enter tunnels in the maxilla here. The anterior superior alveolar nerve arises from the infraorbital nerve within its tunnel and runs downward and forwards within the bone. The superior alveolar nerves, anterior and posterior, form a loop within the maxilla. From this loop, dental and gingival branches arise that supply the upper teeth and the upper gums. The maxillary nerve also gives off palatine and nasopalatine branches that supply the palate and parts of the nasal cavity. To see where these go, we'll look at a skull that's been divided in the midline. The opening that's illuminated is the sphenopalatine foramen, which opens into the pterygomaxillary fissure. The maxillary nerve enters the fissure from behind here. Two palatine nerves, the greater and lesser, arise from the maxillary nerve and run down through a bony tunnel that's been partly opened here. The palatine nerves emerge here through the palatine foramen. The palatine nerves provide sensation to the palate from here to here. In addition, the greater palatine nerve has nasal branches. Together with nasal branches from the trunk of the maxillary nerve, these supply this part of the lining of the nasal cavity. The nasopalatine nerve passes through the sphenopalatine foramen, round the front of the sphenoid sinus, and onto the nasal septum. The nasopalatine nerve supplies the nasal septum, then passes through the incisive foramen in the maxilla to supply the anterior part of the hard palate. Last of all, the maxillary nerve gives off a zygomatic branch. This divides into the zygomaticofacial and zygomaticotemporal nerves. These pass through the zygomatic bone, emerging here to supply this part of the cheek. Now we'll move on to look at the third division of the trigeminal, the mandibular nerve. Here's the mandibular nerve leaving the trigeminal ganglion. The mandibular nerve passes downward through the foramen ovale. The foramen ovale emerges under here. The foramen is just behind the root of the lateral pterygoid plate. Returning to the dissection, here's the mandibular nerve branching as it emerges from the foramen ovale. The mandibular nerve has both motor and sensory branches. Its motor branches, here they are, go to the muscles of mastication, masseter, temporalis, and the pterygoid muscles. Small branches not seen here supply tensor tympani and tensor palati. The other branches of the mandibular nerve are almost entirely sensory. This branch is the buccal nerve. It runs downward and forwards to supply sensation to the cheek, both outside and inside. This branch is the auriculotemporal nerve. It passes deep to the neck of the mandible, which is here, then runs upwards to supply sensation to this region on the side of the head. This leaves two major branches which run downward on the medial pterygoid muscle. They're the inferior alveolar nerve, and just in front of it, the lingual nerve. Seen from the inside, the lingual nerve is here, the inferior alveolar nerve is here. The insertion of the medial pterygoid muscle is here. The inferior alveolar nerve follows the medial pterygoid muscle down toward the mandible. It enters the mandible through this opening, the mandibular foramen. As it enters the bone, the inferior alveolar nerve lies just behind this projection, the lingula. To follow the course of the inferior alveolar nerve in the mandible, we'll remove the overlying bone. Here's the inferior alveolar nerve entering its tunnel in the bone, the mandibular canal. Just before it does so, it gives off this mylohyoid branch, which runs downwards in this groove to supply the mylohyoid muscle and the anterior belly of the digastric. Passing along the mandibular canal, the inferior alveolar nerve gives off branches that supply the lower teeth and gums. A large branch, the mental nerve, emerges through the mental foramen, which is here. The mental nerve supplies the chin and the lower lip. Now we'll look at the lingual nerve. To follow it, we'll first remove the inferior alveolar nerve and the buccinator muscle. This brings us into the oral cavity. The lingual nerve passes close to the mandible. To follow its course, we'll remove this part of the mandible. We'll also remove the mucosa from the side of the tongue and the floor of the mouth. Here's the lingual nerve. Now that we can see it all, we'll follow it from the top. Up here, the divided stump of the inferior alveolar nerve has been displaced forward so that we can see an important detail. Early in its course, the lingual nerve is joined by this nerve, the chorda tympani, which is a special branch of the facial nerve. The lingual nerve runs down toward the corner of the medial pterygoid muscle, passing just medial to the buttress of the mandible. The lingual nerve passes forwards along the base of the tongue, giving off branches along its length. The lingual nerve provides common sensation and also taste sensation to the anterior two-thirds of the tongue. The taste fibers that travel in the lingual nerve are carried by the chorda tympani. Now we've looked at the first 6 cranial nerves. Let's review what we've seen so far in this section. Here are the filaments of the first cranial nerve, the olfactory. Here's the second cranial nerve, the optic. Here's the third nerve, the oculomotor, its upper division and its lower division. Here's the fourth nerve, the trochlear, and here, out of order, is the sixth, the abducent. Here's the trigeminal nerve, the main trunk, the trigeminal ganglion, and the three divisions, the ophthalmic, the maxillary, and the mandibular. Here are the main branches of the ophthalmic, the frontal nerve, the nasociliary nerve, the lacrimal nerve. Here are the main branches of the maxillary, the infraorbital, the posterior and anterior superior alveolar, the palatine nerves, greater and lesser, the nasopalatine nerve, and the zygomaticofacial and zygomaticotemporal nerves. Here are the main branches of the mandibular nerve, the buccal nerve, the motor branches, the auriculotemporal nerve, the lingual nerve, and the inferior alveolar nerve. We'll move on now to look at cranial nerves 7 through 12. We'll begin with the 7th and 8th, the facial and vestibulocochlear nerves. As we've seen, these two nerves leave the brainstem just below the pons. Here's the facial, here's the vestibulocochlear. To follow them, we'll look at a dissection of the posterior cranial fossa, in which the cerebellum has been removed. Here's the back of the petrous temporal bone. Here are the facial and vestibulocochlear nerves. This is the vestibulocochlear nerve. This is the facial nerve. Together they pass through this opening, the internal auditory meatus. Here's the internal auditory meatus in the dry skull. It's a short tunnel with 3 openings. The facial nerve passes forwards through this one to enter its own bony tunnel, the facial canal. In the facial canal, the facial nerve has a complex course in the temporal bone, passing round the wall of the tympanic cavity and coming out behind the styloid process here. To get a view of its course, we've removed the front wall of the external auditory meatus along this line. We've also unroofed a small part of the petrous temporal bone here. To represent the facial nerve, we'll add this green wire to the picture. Entering its canal, the facial nerve passes forwards briefly, then makes an abrupt U-turn called the genu and passes backward. To follow it, we'll come round to the outside and look into the tympanic cavity. The facial nerve passes backwards high in the medial wall of the tympanic cavity, above the oval